Hello, my name is Tabitha Mills, and this presentation will be about a skin disease called eczema. The word eczema comes from a Greek word meaning to bubble or boil over. There are over 30 million Americans who suffer from this skin disease. People of all ages can have eczema, although it is usually seen in the childhood years. Most typically, when children become adolescents, their eczema calms down and becomes very manageable. However, there are still cases where eczema starts in the adult years. Okay, so what exactly is it? Eczema is most commonly known as atopic dermatitis. It is a general term for a set of chronic medical skin conditions where patches of the skin are usually rough, dry, and/or inflamed. These patches usually have little blisters that cause itching and scratching, which results to irritation and some bleeding. This starts to become a cycle. Research has shown that atopic dermatitis can be caused due to a defect in the skin's epidermal layer. Microbes or allergens are able to penetrate the first layer and cause irritation. Causes and triggers. So I'm first going to talk about some of the causes. Eczema is most often inherited by a family member who has the skin disease as well, or who has had hay fever or asthma. As mentioned before, it can also be due to a person's inability to repair skin damage, as well as others, and allow allergens or microbes to penetrate through. Once a person's skin is broken, moisture is able to leave the skin, which causes the person to have xerosis, dry, flaky skin. Diet can also affect some people. For example, if a person has a food allergy, then their eczema will flare up when eaten. It is also believed that the atopic triad is linked to eczema. The atopic triad includes atopic dermatitis, hay fever, and allergic asthma. Some of the triggers that can act eczema up include irritants like soap and detergents, allergens including pets, dust, pollen, microbes like bacteria and fungi, temperatures, foods like dairy, nuts, and shellfish, and stress and hormones. Okay, so now we get to symptoms. Symptoms for eczema include dryness in the skin, intense itchiness, red scaly patches, blisters, a watery fluid that weeps from the affected area, and lesions. Eczema can appear anywhere on the body, but it is most commonly found behind the knees and on the elbows. The pictures to the left show the different types of rashes people can get and the severity of it. Now we get to treatments. Unfortunately, there is no actual cure for eczema, but there are still treatment plans that can help reduce flare-ups and keep them maintained. So, to start off, the most important step to take is hydrate. This means drinking water and moisturizing throughout the entire day to get the skin from being dry. It is best to use some type of emollient cream because they also add moisture to the skin. There are also anti-inflammatory ointments which come in various strengths and are prescribed by the doctor. Coal tar helps reduce itchiness, and UV radiation therapy can help reduce the symptoms of chronic eczema. There are also oral anti-inflammatory medications that can be given. Now, here are some tips on how to cope with eczema to have a more comfortable, itch-free life. It is important to keep up good hygiene. People with eczema are more vulnerable to infections and cold sores, which can make atopic dermatitis worse. Take lukewarm baths and avoid hot showers. Use soap-free products, salt baths, and when drying with a towel, it is better to pat dry than rubbing. It is also important to reduce anything that can irritate the skin. For example, wear layers so you can prevent getting too cold and take the layers off when needed. Using cotton is best for the skin since it is soft, but any other soft material will do as well. When dealing with detergents, it is recommended to use gloves and to use fragrance-free products. Also, it will be beneficial to moisturize as much as possible when coming out of any chlorinated pool. Some general tips are to keep nails short. This will prevent breaking of the skin when itching, and lastly, enjoy the sun in moderation. Eczema symptoms can be relieved by the UV rays. However, you still want to take precautions in the damage the sun can do, like skin cancer. Here are my references if you are curious to learn more about eczema or have any other questions. Thank you very much for your time, and I hope you enjoyed this presentation.